Do you know what dissociative identity disorder is?
No.
Do you know what dissociative identity disorder is?
No clue.
Do you know what dissociative identity disorder is?
I do not know what that is.
Alvin, do you know what dissociative identity disorder is?
I don't know that.
Do you know what dissociative identity disorder is?
Yeah.
Do you really?
No.
Sadly, not many people do. Dissociative identity disorder is a severe condition in which two or more distinct identities or personality states are present in and alternately take control of an individual. Some people describe this as an experience of possession. The person also experiences memory loss that is too extensive to be explained by ordinary forgetfulness.
For someone to be diagnosed with dissociative identity disorder, they must have two or more distinct identities or personality states, each with its own enduring pattern of perceiving, relating to, and thinking about the environment and self. The disruption in identity involves a change in sense of self, sense of agency, and changes in behavior, consciousness, memory, perception, cognition, and motor function. Frequent gaps are found in the memories of personal histories, including people, places, events, from both the distant and recent past. These symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning.
Characteristics. Different identities can emerge because of specific circumstances, like being in a high-stress situation. The change can be very subtle and almost unnoticeable or incredibly obvious and dramatic. People with DID may describe feeling they have suddenly become outside observers of their own speech and actions. They might report hearing voices or having uncontrollable thoughts that aren't really theirs. The individual might also experience sudden impulses or strong emotions that they don't feel control or sense of ownership over. People may also report that their bodies suddenly feel different, like a small child, huge and muscular, or they experience a sudden shift in attitudes or personal preferences before shifting back. Sometimes, people with DID experience dissociative fugues, where they discover that they have traveled but have no recollection of the experiences. People vary in their awareness of their amnesias, and it is common for people with DID to minimize their amnesthetic symptoms, even when the lapses in memory are obvious and distressing to others. More than 70% of people with DID have attempted suicide, and self-injurious behavior is common among this population.
The risk of developing DID is increased by stressful situations during childhood. 90% of people diagnosed with DID suffer some sort of overpowering, life-threatening trauma at an immature age. People with DID also often have PTSD from the events in their childhood. DID is more likely in families where other members have DID.
The debate around DID. Some psychologists do not believe that DID is real. They believe instead that the patient is highly suggestible, and other psychologists are inadvertently implanting the idea of multiple personalities into them. This, however, appears to be false, as the changing of identities can be seen on a brain imaging scan.
Long-term psychotherapy is one of the only effective treatments for DID. The goal of the psychotherapy is to break down the multiple personalities and mold them back into the normal, healthy personality. There is no medical treatment for DID. However, many people with DID are also likely to have depression and anxiety, which can both be treated with medication. Even though only 1 to 3% of the population suffers from DID, it's no less important. People who do struggle with DID face great difficulties and stigma related to their condition. Hopefully in the future, better techniques will be developed to treat the disorder.